So a very good afternoon, everyone. Welcome to the fourth and final session of our webinar series, Overshadowed by COVID-19, Neglected Diseases in the Spotlight. Well, first of all, we'd like to thank all of you who have joined us here today, as well as those who have joined us throughout the webinar series from the very beginning. In the coming hour or so, we hope to shed a bit of light on methanol poisoning, which is a public health issue that has been neglected for decades and often dubbed as a forgotten crisis. My name is Fiona, and I am a medical research and analysis officer with MSF, and I currently coordinate the Methanol Poisoning Initiative, which is a joint venture between MSF and the Oslo University Hospital in Norway. And the aim of this initiative really is to try and reduce the harmful effects of methanol poisoning and to improve the survival of those who are affected by it globally. So before we start the discussion proper, just a couple of house rules to sort of take note of. All the participants, I think it should come up in the slides in a bit. Yeah, so all the participants apart from the speakers are muted. If you have any questions, please feel free to use the chat box function at the bottom of your screen. You are welcome to submit any questions that you may have on the topic throughout the session, and we will have a dedicated Q&A session at the end of our discussion, and we'll do our best to respond to your questions then. And we will be recording the webinar for future viewing. So at this point, I'd like to share that this live discussion today is organized by Médecins Sans Frontières, or MSF, which is an international medical humanitarian aid organization that provides free, quality medical assistance in over 70 countries globally to people who are affected by armed conflicts, epidemics, natural disasters, and exclusion from healthcare. So here is a short video to briefly introduce our work.
I don't see what she's wearing.
How he earns money.
What phone he has.
I don't see who she prays to.
That she's a threat.
Which border they cross.
I don't see if he's a soldier.
If he's a refugee.
Which side they are on.
I just see a child. A human being.
A patient. Doctors Without Borders.
Independent.
Neutral.
Impartial.
So that was a little bit about MSF, and now moving on to the main topic for discussion. So methanol poisoning has long been, a public health concern for decades now, since the 20th century, really. But it was only during the COVID-19 pandemic that we sort of saw, news reports started surfacing on the dangers of alcoholic disinfectant products containing excessive amounts of methanol, which actually led to a bit more public attention on this issue of methanol poisoning. For today, we are going to zoom in on methanol poisoning in Iran, as well as in Southeast Asia, where the prevalence of methanol poisoning is high. At this point, it is my pleasure to introduce our esteemed speakers that we are very privileged to have with us today. First, joining from Iran, we have Dr. Hossein Hassanian Moghadam. He is currently an associate professor at the Department of Clinical Toxicology, Shahid Beheshti University of Medical Sciences, which manages the Lokman Hakim Hospital, the main referral hospital that receives over 20,000 poisoned patients every year in Tehran. He is also the president-elect of the Asia-Pacific Association of Medical Toxicology. Welcome to the discussion, Dr. Hossein. Next, we have Dr. Chanri Lim. She's one of our own. She's an MSF doctor from the Philippines, and she is currently the medical coordinator for the MSF Syria project. And back in 2017 and 18, she was actually the medical coordinator for the MSF Indonesia project, where she was involved in a number of methanol poisoning initiatives, including trainings and workshops for local medics. And since then, she's continued to be a strong advocate on methanol poisoning, and she's conducted a series of lectures in the region, including in the Philippines, such as at the St. Luke's Medical Center and the University of Philippines General Hospital. Just to mention that where Dr. Lim and Dr. Hussein are both calling from, the internet connection and the electricity may be disrupted. Should there be any interruptions from our speakers, we do apologize in advance, but hopefully it will be okay. So once again, welcome Dr. Hussein and welcome Dr. Lim, and welcome to all of you who are joining the session on methanol poisoning, the illegal brew that kills. So despite outbreaks of methanol poisoning happening for decades now, I think this topic is still relatively quite new to many people. Methanol in itself as a chemical compound is not toxic, but when ingested, it metabolizes in the body into toxic substances that can cause or lead to visual disturbances and death. To begin our session today, let's watch an educational video on what is methanol poisoning to give you a brief glance on the topic.
Methanol poisoning is a global health threat. All over the world, it is added to illegal alcohol for profit reasons. The victims cannot see, smell, or taste the methanol in their drinks. Methanol causes delayed organ damage. 12 to 24 hours after, sometimes more, the effects can be seen as chest pain, abdominal pain, hyperventilation, and vomiting. It will often cause brain damage of varying degrees, or visual disturbances and blindness. Frequently, it leads to death, affecting families and whole societies. Have you been drinking illegal alcohol and experienced these symptoms? Could it be methanol poisoning? Methanol kills thousands globally, but most cases remain undocumented. Don't become a victim of methanol poisoning. Seek medical attention immediately. It may save your life. Learn more on msf.no/MPI.
So I hope you found that video informative. At this point, we actually have a quick poll for all of you, and it should pop up on your screen in a couple of moments. So a fairly straightforward question, which country has the highest reported prevalence of methanol poisoning over the decades? Is it Cambodia, India, Indonesia, or Iran? Of course, as a matter of fact, I think all these countries have reported incidents of methanol poisoning. And in some of these countries, methanol poisoning is an endemic problem. But before I give away too much, let's see what the responses are. I think the live results should appear in a couple of moments. Right. So fairly equal. We have 35% saying Indonesia and 31% saying Iran. So just to, I guess, keep this a bit more interesting, we will disclose the answer at the end of the session. But thank you all for participating in the poll, which I think is actually a very good question to kind of jump off from. Because I'd like to start our discussion by inviting Dr. Lim and Dr. Hussein to briefly explain about the methanol poisoning situation in Southeast Asia and in Iran. Let's start with Dr. Lim. Having worked on methanol poisoning in the region, could you share a bit, with the audience, which countries in Southeast Asia do we typically see incidents of methanol poisoning, and why is it happening in these countries?
Hi, good morning. Thank you so much, Fiona, for this. So just to give a little bit of a brief summary of methanol poisoning in Southeast Asia. So what you can probably see is that methanol poisoning in Southeast Asia, we have quite a long-standing love-hate relationship in this topic. Why am I saying this? Is because if you look at it in the context of the Philippines, in the Philippines, it has been happening since a long time ago. We have what we call a colloquial term in the Philippines wherein we term methanol poisoning as gin bulag, wherein people actually get blinded from drinking too much gin. It actually is a terminology that was coined in the early 90s, wherein there was a massive outbreak of methanol poisoning, but then not a lot of doctors were able to actually diagnose this. This same topic actually came into the highlight again in the early 2018, 2019, wherein there was the incidence of methanol outbreak because of the Cosmic Carabao incident. This came into the highlight because the Cosmic Carabao incident was actually a brand of alcohol that was brewed in the Philippines, and it was actually being sold in very high-end stores all over the country. So it created quite a buzz. However, what people doesn't see is that even the local brood that we have, the lambanog, has actually contributed a lot on the incidences of methanol poisoning in the Philippines. And then if you look at it now in the context of Indonesia, for example, it's very, very common. You have what they call the oplosan poisoning, or they call it different terminologies, arak. In Indonesia alone, if you look at it in the Lonely Planet, and if you travel most of the time to Bali, there's actually a warning about you not drinking alcohol in any of the bar, even though this bar will actually say like, yes, we get it from a legal source, that this is coming imported and all of these things, because the number of cases that we are seeing in the country is also very, very high. One of the biggest incident that they had in the recent past was in the 2018 Bandung incident, wherein quite a lot of people was actually poisoned. And then the hospital actually had difficulty in actually accepting all the patients because they came all at the same time. And this is where the Indonesian government actually recognized that methanol poisoning is actually something that is quite common in their country. If you look at it in this past year, for example, there was one big incident that happened in Cambodia, wherein they did this rice wine during the celebration, wherein also a lot of people got poisoned. So if you look at it, and again, this is what Fiona has been saying, is that if you look at it in the context now of Corona, if you recall, there was a lot of this hand sanitizer that was recalled in Las Vegas because of the high content of methanol in it. I think one of the things that we have to take into consideration at this time for the Corona is a lot of the misconception that sanitizers or alcohol can actually cure the disease. So these are a lot of the misinformation that we are seeing in the recent times during this pandemic, wherein actually people are actually ingesting hand sanitizer, for example, mixing it with different local brews, or and that's where people actually get poisoned. So if you look at it based on epidemiology, it is quite common, especially now in the times of COVID, because of all the misinformation that we are seeing.
Yeah, and I think it's really interesting, Dr. Lim, that you mentioned about how these sort of poisonings are happening in COVID-19, of people adding this sort of methanol and whatnot to their drinks. And I think this was actually the case in Iran, where based on false beliefs or misinformation on methanol or alcoholic products being used as a cure for COVID-19 and to prevent the disease, this actually led to a significant loss of life. So I'd really like to turn the discussion now to Dr. Hussain, if I may. Dr. Hussain, could you briefly walk us through, what was the methanol poisoning situation in Iran, especially during the COVID-19 pandemic?
Yeah, thank you very much for inviting me, and thanks for Dr. Lim for the introductory for introduction of methanol and the situation among different countries. Actually, Iran is not far from those methanol poisoning and outbreaks, but nowadays I can claim that Iran is an endemic area for methanol poisoning. It is almost from 10 years ago that we are seeing a lot of methanol outbreaks, but in different scale in different provinces. And it refers to ban of alcohol because Iran is a Muslim country. So like many other Muslim countries, the alcohol drinks is banned. And many people who are interested to drink alcohol are going to black markets to find a good alcohol over there. And you know, it is not always the case, because even those who have access to brand alcohols, the brand alcohols also are illegal. And some of them are packages in different cities inside the Iran, inside the Kurdistan, or inside the Iraq. So there is a market in the region, and many people who are not familiar with these faked market may take the alcohol and drink it. And during COVID-19 case from almost more than 1 year ago, when we faced the COVID, there was a huge need for alcohol, because you know, alcohols are using for disinfection of the surfaces and disinfection of the hands, etc. So there was a big demand on alcoholic products, and unfortunately, many workplaces started to produce illegal alcohols and released it in the market. And even hand sanitizers were full of methanol, that it is not useful for using as a rubbing alcohol. And also there were some bootleggers that start decolorating industrial alcohol containing methanol to show that they are ethanol products, and release it in the market. So both alcohol drinks and hand sanitizer were full of methanol. And people who wish to disinfect themselves based on false rumor, actually they drink the alcohol to wash their bodies in order to overcome COVID-19 or prevent COVID-19 in both beliefs. And up to now, we have more than 1,000 death cases of methanol poisoning, and almost 5% of them declared that they got alcohol in order to prevent or treat COVID-19.
Yeah, and I think this particular incident in Iran actually recorded the highest number of cases and deaths ever reported in history in a methanol poisoning outbreak. But in fact, as you know, both of you has mentioned, even before the pandemic, we were already seeing, you know, thousands of people affected by methanol poisoning every year, with sometimes fatality rates of as high as 20 to 40% in an outbreak. You know, on this point, I actually wanted to circle back on the theme of this webinar series. Methanol poisoning, you know, has been existed for decades, and it has caused significant morbidity and mortality globally. Could you share with us, maybe Dr. Hussain, why is methanol poisoning still a neglected disease?
Yeah, thank you. This is a very, very important and good question. You know, by definition, neglected diseases are those diseases that they are not receiving much attention. And as you know, and as many of us may know, even for us, for me as a physician, I haven't had any training in toxic alcohols during my medical student program. So many of us have the same problem. And, you know, as a neglected disease, they usually occur often in developing countries of the world, who are facing deficient healthcare access. So the importance is in both medical and also socio-economic level. If you review methanol, you can understand that all of these characteristics can be seen in methanol poisoning. Many of physicians have never seen a case of toxic alcohol during, let's say, the training, and the majority of methanol poisoning outbreaks are in developing countries, particularly in Middle East and Asia. And as you asked the audiences, all of the countries over there from this area, from India, from Cambodia, Indonesia, Iran, and even Turkey. And we have also reports from other parts of the world, but I think especially for African countries, it is underreported. So as Dr. Lim said, it is a hidden area of neglected diseases, and we should pay more attention to it. So unlike many other diseases in neglected disease area, usually our patients are among young population because they are more curious about the alcohol, especially among Muslim countries. Just they want to have experience on how does it mean, for example, drunkenness. So many of my patients, it was their first experience attempting, alcohol. And imagine I had some patients that just they are 16, 17, 18. They are very, very young, and now they are blind. And imagine that how it can impose a huge burden of disease in the society and in the healthcare system. So in terms of acute phase, it can kill a lot of people, especially those who are not trained in the country, those who are not trained in treating these patients. There are not a good range of public concern in those communities. And the outcome is completely clear, and it can impose years of life loss and and also years of healthy life loss due to blindness and also further disabilities.
Let me just jump on.
I think it is in yeah.
I mean, let me just jump on also on what Dr. Hussein said. I think methanol poisoning, why we considered it really as a neglected disease, is that there's such a big amount of stigma behind just saying that it's an alcohol intoxication, it's methanol poisoning. Nobody actually thought that the patient that we are seeing are actually victims. People already have a prejudgment because, oh yeah, why will I care about this person? It's his fault, he drank alcohol, especially in a very culturally or religious country. For example, if you look at it in Indonesia, wherein alcohol is actually not allowed to be, sold in the market, it's a little bit of this stigma that we really have to fight on. People doesn't look at these patients that we are seeing as patient in itself, but there's already a prejudgment. I mean, look at it in a lot of the hospital. If you have to choose between a drunk person that will come to your emergency room versus a patient that will come with probably high-grade fever, the amount of focus that you will have in these two patients, you will actually probably go to the patient with high fever, but then it's like, oh yeah, she's just a drunkard. Why do I care about this one? And I think this is why Dr. Hussein has a very, very good point, because majority of the people that we are seeing that was victimized, we call that this patient victim because it being poisoned with methanol, it's something that people actually do, it's not naturally occurring. So, and then if you look at it on the victimology that we are seeing robust young man, head of the family, breadwinner. So you have to also think about that these people also have families that they are supporting. And because of this lack of awareness that we are giving in this very significant topic, especially now with COVID-19, we are actually seeing a lot of misdiagnosis, a lot of not focus on this really specific topic that, yes, it becomes neglected. If you look at it mortality-wise, 20-40% is quite a high mortality. If you look at it on other preventable diseases, if we have that kind of mortality, we will be calling for an emergency response and all of this. But because there's so much stigma and social prejudgment on this topic, it becomes so much neglected that nobody wants to actually put a focus on it. So I think this is why this topic is really, really very important to put a little bit of focus on.
Yeah.
Well,
and also I should add and highlight the stigma, especially in Muslim countries, because they are afraid of the cultural beliefs. They never claim in the emergency department that they drink alcohol. So considering that we have not enough structure to detect alcohol inside the emergency room, it can deviate the mind of the physicians that probably something else is responsible for loss of consciousness, for metabolic acidosis, for different presentations that the patients are coming with. So the physicians in this situation should be smart enough to ask them directly, have you ever drank an alcohol? Unless you shouldn't expect that they tell you about the drinking alcohol with the peers, something like that. And for follow-up also, it is very, very important, because for us as a physician, we should make a good relationship to the patients, and also they should trust us. It's the art of the physician, that we are not a policeman, we are not the religious person. We are a doctor coming here to help you. So tell me everything. And in this way, you can find the peers. It's so important, because when they are drinking something, they are drinking together. But the presentation is not the same. They are not coming at the same time. Sometimes I have different patients that they are sitting and drinking the same amount of alcohol together. One is killed, one is blind, and the other had no effect. It all refers to different metabolization and also the enzymes involved in the metabolism of the patients, and also nutrition status of the patients, and those sorts of things, and also genetical aspects of the diseases. So just I want to stress that we should ask them directly in a confidential way to make a good relationship and go through it for further assessment.
Yeah, and that's why. Yeah, sorry. So it's just I just wanted to add on. That's why it's quite important that, once you properly diagnose this one, you can save quite a lot of people, because when there is one, there's always many. And that's why you always have to be very aware of this topic, because the saving of the lives that you have, because it's easily treatable, it will be super significant.
Well, thank you so much for that, Dr. Hussain and Dr. Lim. I think you've brought up very, very important points there, and also this issue of misdiagnosis. We call it a great imitator almost, because sometimes when a patient comes, they present with certain symptoms, and we may not necessarily be able to detect or identify the case as having methanol poisoning. And also another very important point that both of you highlighted is that methanol poisoning is not only a medical issue, but also a social one, because the social impact is really significant. But as a community, we can actually do something about it, starting with educating ourselves, our professional circles, and also the communities that we're living in, in this hidden or forgotten crisis, so that, we too can sort of look out for one another. And Dr. Hussain, you've spoken a little bit about how to deal with, patients when they come, and how to identify and things like that. So I was just wondering if I could ask, Dr. Lim, maybe, from a consumer or user perspective, how does one sort of distinguish ethanol from methanol, when they go and get a drink? How do they distinguish? Because as we saw in the video earlier, there's no smell, no color for methanol. How can a user kind of be more careful about that?
Yeah, I will put this in the perspective of I think if you look at it based on the consumer point of view, is that alcohol in itself, you have quite a different kinds of variant. So in the Philippines, for example, we have 3 different kinds of alcohol. We have ethanol, we have, as you said, the methanol, and you have isopropyl alcohol. This is quite widely used in the Philippines. And each of these 3 different kinds of alcohol will have different signs and symptoms. And I think that's why we always stress a little bit on the clinician to always be aware of it. That's why we are trying to raise a lot of awareness on the topic. Because also one of the difficulty in diagnosing it is because there is no standard diagnostic test for alcohol poisoning or any kind of this one, you know. So it's so difficult for us to diagnose this disease, and that's what in a consumer's point of view, it's also very difficult for the clinician to actually pinpoint, okay, what is it? There's a lot of research being done now regarding diagnosis of alcohol poisoning, and I think Dr. Hussein will have much more information about this one.
Yeah, Dr. Hussein, I'm not sure if you have anything else to add on that, but also as you've alluded to earlier, educating the medical communities, the frontline workers, is so important given the diagnostic challenges, that is a barrier to methanol poisoning. And today we actually have a good number of medical professionals and medical students who are joining us in this webinar today. So, what is important, I think, for clinicians to sort of be aware about what is your message to them, in terms of identifying and managing a patient given the diagnostic challenges of methanol poisoning?
Yeah, actually, I was able to read some of the question in question and answer chat box, and this is the question of many healthcare providers. And let's start to distinguish between a clinical presentation and also from the alcoholic beverage consumer perspective. For lay people, it is almost impossible to distinguish between methanol and ethanol because the smell are almost similar, and both of them are volatile. And both of them, as you said, are colorless, flammable. So we cannot distinguish them by, physical characteristics and something like that. There is a test called iodoform, but it is not possible to do it at home. And someone should be experienced to do some sort of tests. Also, there are different tests using chemical colorimetric test that can somehow distinguish between methanol and ethanol. But as you may know, this is not possible for ordinary and lay people. And just they consume something and understand that they are ill. And if they are lucky, they come early. And then this is the duty of the physicians to understand the disease and also treat them appropriately. I have some key points for clinical presentation of the patients that it is very useful even in limited resource area and in low-income countries. First of all, it is the time of presentation. It is very important to understand that for most of the toxic alcohols, especially ethylene glycol and methanol, it takes time for the parent alcohol to be metabolized to toxic byproducts. So especially in case of methanol, the presentation is late. If someone is coming to the emergency department and say, I've drank alcohol, and you are suspicious that this is toxic or non-toxic alcohol, the first question that is coming out is to understand that what was the time of ingestion. If the time of ingestion is within 2 or even 3 hours, that should be ethanol, or in the worst case scenario, it would be isopropyl alcohol, because isopropyl alcohol is also able to inebriate the patients, and they come soon. But after a while, you can distinguish between ethyl alcohol and isopropanol alcohol due to a smell of alcohol. You know, the smell is somehow fruity in isopropyl alcohol, while in ethanol, you know the distinctive smell of ethanol. And also by passing the time, you can understand that people have metabolic acidosis. It's, if we have a simple blood gas analysis, that is, I think that is provided in most of the hospitals nowadays, even in Los area, it would be very helpful to understand how much metabolic acidosis exists in the blood. Usually for for ethanol, it's not, even if they are drunk, you cannot see pH something like less than 7.13. But for methanol and ethylene glycol, you can see a lot of patients that even come with a pH less than 7. But let's back to the clinical presentations. So like the other people who drink a lot of alcohol, for ethanol cases, you can see vasodilation and drunkenness. Usually people are aggressive, depends on their personality, and they may be talkative. All presentation of those people. But for toxic alcohols, ethylene glycol and methanol, it's not the case. Usually they are calm, they are not aggressive. You usually find them, if they can relate, you usually find them in a shock state again. So just completely different. So we should put these puzzles all together to differentiate between toxic and non-toxic alcohol. The other presentation is ophthalmic presentation. You know, when someone is coming with metabolic acidosis and at the same time with visual disturbance, you should consider at the top of your list just methanol poisoning. There is no other illness to be presented like this, and it is very, very important. Even for loss of conscious patients, if you see the pupils, you can see that they are dilated. Sometimes they have sluggish to light response. Sometimes you cannot any response even. And if they are alert, and you ask them, they can tell you that they have some visual difficulties, and you know, as far as the visual difficulties is prolonged and we do nothing for the patients, you can see the outcome would be worse. And unfortunately, even if the patient is survived, many of them face visual disturbances for the rest of their life.
Yeah.
The other, let me explain the other presentations that the people came, because I understand that it is helpful for many of the physicians in poor resource area. Many of them have no access to measure ethanol, to measure methanol, and even they may have no access in rural area to blood gas analysis. So the only thing that they should rely on is history and clinical examination. And it is actually, in my mind, it is more useful than very advanced lab exams that can be done in tertiary centers, but in a late presentation. I mean, if we treat the patients, but by simple clinical examination and by simple taking history in a confidential context, we can earn a lot of information and treat the patients from the side. We don't need to transfer the patient, because sometimes in rural area, it takes a lot of time, and time is tissue. We should do something in the first situation. And what is the first, treatment? The first treatment, even if you are not sure about the toxicity of alcohol is simply to give them a bottle of alcohol, but reliable, from a reliable source. It can save many of the patients till they go to the tertiary center. You know, there is an interesting study from Czech Republic that they start giving their patients alcohol in ambulances. Then they call the ambulances. And none of those patients died. It is a very, very important message. Whenever we start the treatment from the side, we would be more successful in treating the patients. You can imagine that I have nothing here. I have no access to lab exams, and I have nothing. I have no cutting-edge antidotes. Where is the fomepizole? Even I have no access to, you know, many basic medications. So I should transfer the patient. It's not the right way. If you want to transfer the patient, you should give the first dose of alcohol, and we will talk about it later more. And let me complete the clinical presentation. If the patient is coming with seizure, convulsion, and the central nervous system symptoms, you should think about the toxic alcohol and the top for methanol poisoning. And also the smell of alcohol sometimes is useful, especially in delayed presentation, because you have no smell of alcohol in delayed presentation of methanol cases. And when you imagine that patients are going to have a metabolic acidosis, in response to metabolic acidosis, the patients should have acidemia and following tachypnea. So you can see by examination and taking the vital signs that the respiratory rate is high.
Yeah, thank you so much for that, Dr. Hussain. Unfortunately, because we do, you know, yeah, we wanted to talk a little bit on the treatment issues as well, which you have also touched on a little bit. I was just wondering if I could just bring Dr. Lim in just to briefly, if you have anything to add on this issue of treatment before we actually move on to the Q&A session.
Yeah. So no, for me, what I just wanted to add on is that, and that's why it's so paradoxical, because the treatment actually for methanol poisoning is also alcohol. And I think because of this also, there's a lot of hesitancy from healthcare professionals, if you look at it, especially on countries wherein alcohol is like a taboo topic. And also because, for example, if you go to an emergency room and you tell this one patient that comes to you with a diagnosis of methanol poisoning and said, okay, have some more vodka, and you're already drunk. So there's a lot of this hesitancy to actually start a patient on. The biggest challenge that we are having now in this era and time is that one of the best antidote there is, which is fomepizole, is currently not very accessible to the general population because of its cost, because of how difficult it is to also get it, even though it's very, very significant in treatment of methanol poisoning. And I think because of this, there's a lot of initiative that is being done to make sure that it becomes more available to people, especially to low mid-income countries. So there's a lot of initiative has been on the works for this one. And I hope that, you know, it will go on, because as you also know, IV ethanol is also not very readily available. So majority of the times when we actually treat methanol poisoning is we actually ask them to ingest large amount also of ethanol or alcohol in itself. So this is a little bit why it's so paradoxic, because one of the things that is very, very important which is the antidote, is not readily available. And then you have this very cheap one that is readily available, but it's becoming a bit of taboo, because why am I gonna give a drunk person more alcohol? Then they will become more drunk. So this is also a lot of the things that we need to also, you know, push forward. So because these are a lot of the gaps that we are actually seeing. Yeah.
Thank you so much, Dr. Lim. And I think one of the things that MSF is also focusing on is really on this advocacy of, having fomepizole more available and accessible to those who are affected. So thank you both, Dr. Lim and Dr. Hussain, for all your very insightful input so far. As we are, running short on time as well, and I'm really enjoying the conversation. And thank you so much, Dr. Hussain, for all those very important points. I think that a lot of our audience will be able to bring home with them today. But I'd just like to move on to the Q&A session, actually. And we have one that has come in through the Q&A box, and this is for Dr. Lim. So how are we able to diagnose methanol poisoning in resource-limited countries or in the field?
Yeah, so what we have been doing, especially in a lot of our project within MSF in itself, is that we actually made a clinical guidelines that is actually just focused more on, as what Dr. Hussain has been saying. Huh? And I think this, we have to go back as a clinician, that we have to always strengthen the basic knowledge that we have on history and physical examination. So as what Dr. Hussain has been saying, in very resource limited setting, it's very important that you go always back to the history. When was the time of ingestion? If you saw a patient that is drunk, usually they will come with a relative or they will come with a friend. And this is now where, okay, did this patient actually come from a party? When was the ingestion? What was the time of the ingestion? So, and then you focus a lot on the physical exam. So as what Dr. Hussain was saying, so if you have tachypnea, for example, breathing very, very fast, if you have ocular symptoms, this is highly, highly suspicious of methanol poisoning. And if you diagnose this one on the basic of just history and physical examination, 100% of the time, you're probably going to be correct. And if you give the antidote early on, you will definitely save this person's life. So, yeah.
Yeah, thank you for that, Dr. Lim. And we also have another question for Dr. Hussain. So alcohol consumption in Muslim countries is a taboo for sure. And that must also deter people or methanol poisoning victims from seeking medical help. How can we sort of overcome this challenge?
This is really a socio-economic problem. And I think this is the public health sector that should help us in this issue. In Iran, from many years ago, we start talking to religious leaders that this is a disease. This is something that happened. And like many other people, those people may have mistake, but it is our duty as a physician and the duty of you as a religious leader to save people and also make them a good opportunity for the future. Probably just, I'm not going to the politics and to the religious aspects, but I want to tell you that the likelihood of convincing the religious people and make a public health aspect of how we should confront to this issue is so important. So you can tell a religious leader that they are people who are going to have sin and they are not good people, so let them die. This is one aspect. The other aspect is what I've told you. So you should go through the best way to convince religious leaders that usually have effect on the governments of Muslim countries by different institutions, that we should sit around a table and solve this problem together. We cannot let them, let the population to die. I faced different methanol poisoning outbreaks in Iran. And the strategy to overcome this policy was completely different. But I can tell you the final part. So and the final part is that those who are cooperating with us and those who let us to announce and to warn the community, you can see less victims after outbreak. For example, in Rafsanjani outbreaks, we followed that policy. And even the mosque speakers were talking people that there is an alcohol product inside the community and many people are drinking it. Don't drink and go to that hospital to take a blood exam. And out of the 600 people, only we had 10 deaths without any phenopizol, without any extensive infrastructures. So it shows the importance of public health sector and the negotiation and the policy before we face these outbreaks. So we could solve this problem in Iran, and we can easily administrate alcohol in methanol poison patients. But I know this is not the case for many other countries, including in Indonesia. But I guess because Islam is Islam, we can find a way to convince them to as a medicinal drug for the community. You can tell them that we use alcohol also in some sort of syrups. So it is the same. We are using this as an antidote now.
Yeah. And I think
let me just jump. Yeah, sorry. Let me just jump on what Dr. Hussein said. I think one of the biggest challenge we have when you talk about public health is really policy change, because a lot of this needs to have a lot of engagement. A lot of this needs to have a lot of dialogue, awareness. You have to go to the right people to actually know that, yes, this is a topic of interest. You have quite a lot of people that is dying from this illness. And you always have to make sure that you point it out on a medically clinical subject, that yes, it is, you are dealing with a medical patient, that this is a patient and not somebody that did something wrong. And I think constant dialogue and constant engagement with government sectors, with partners will actually make quite a lot of difference. And these are a lot of the things that we actually did in Indonesia before, where even normal alcohol is not allowed. So we came up with, okay, maybe we do the 70% one that we have in the hospital and put, like, for example, milk on it so that it's not very, very harmful to the gastric lining. So a lot of these things needs to be sure that we do always constant engagement to the people.
Yeah, thank you so much for that, Dr. Lim. So we have one final question from the audience, and I think I would like to direct this to both Dr. Lim as well as Dr. Hussein. How can we improve our epidemiological accuracy and documentation of doing surveillance on methanol poisoning globally if there's this issue of misdiagnosis and lack of awareness? What are your thoughts on this?
Well, I can answer first, huh? And I think this is where now we always...
Yeah, you can answer. Yeah, you can answer.
Yeah. And I think these are things that we need to put a bit of emphasis on, like it's a lot of this, as I said, awareness raising, making people aware that, yes, this is happening, that this can happen in your area. And I think for us, this is how we can improve a lot on this topic as globally, that we always have to raise awareness. We have the constant training to the doctor to make sure that it's always in the back of their mind. Because as what Dr. Hussein said, not a lot of medical practitioners or medical professionals will actually see a patient that is poisoned with methanol. And I think for us, it's always should be a conscious effort for us to always be the one to engage people, to make them aware that, yes, this is a topic that is significant, that this is a topic that is that you can save a life with just a simple treatment and a proper diagnosis. So I think for me, it's a little bit of this awareness raising that we need to really improve a lot on.
I should add something else. Also, you can follow the death registry among different countries. If they are doing everything perfectly, you can find that some of the people are dying from methanol poisoning and they have never diagnosed in the hospitals. Even during COVID cases, in Iran, all of the death certificates in natural or poisoning cases should be registered by legal medicine organization. So all of the death cases goes there. and they have some analysis on their blood. And we found that almost 100 out of 1,000 death cases of methanol poisoning have never been diagnosed in the hospitals. That's a huge number. So it means that our healthcare professionals were not aware of the methanol poisoning and couldn't diagnose the clinical presentation of the cases. I think most of them could understand that these patients with a comatose state has some severe metabolic acidosis, not more. And so this is a hidden area. Many of them haven't had an accurate history, but it is a reality in our community and we should focus on it.
Thank you so much, Dr. Hussain, for that. And thank you everyone for your questions. So before we actually close our session today, I would just like to quickly go back to the poll that we had at the beginning. So which countries actually has the highest prevalence of methanol poisoning over the decades? And the options were Cambodia, India, Indonesia, or Iran. Well, the reality is that, given the lack of attention and awareness and the diagnostic and treatment challenges that Dr. Hussain and Dr. Lim has elaborated during this session, we actually still do not know the true prevalence and the burden, actually, the real burden of methanol poisoning in these countries. And well, among the 4 countries, we do see incidents most frequently reported in countries like India and Indonesia. But what we do know is that what is reported is merely the tip of the iceberg, as many of the cases and deaths actually go undetected. So a lot more effort really needs, to be done to address these issues and barriers in order for us to kind of understand better the true burden of this neglected crisis, as Dr. Hussain and Dr. Lim has mentioned. Yeah, so I guess we've come to the end of today's discussion. But once again, I'd like to thank really our esteemed speakers, Dr. Hussain and Dr. Lim, for joining us and sharing their insightful thoughts and experiences on this very important topic with our participants.
May I add something just briefly in 1 minute?
Yes, of course.
Message, please. We haven't talked about the treatment, and I could see that Professor Natari Kodo addressed how to treat the patients from the website. Thank you very much, Natari. And the key point is that we should do case finding. It is very, very important that we usually neglect it. Whenever we face someone with methanol poisoning inside the hospital, we should think that this is a contaminated resource of alcohol in the community. So instead of sitting in the hospital and treating the patient inside the hospital, someone should go to the community and find them and bring them to hospital. And just by simple remedies like alcohol, we can treat them. Unless you should wait for a huge wave of methanol outbreak with a lot of intoxicated patients and limited IV access and dialysis machine. Imagine that, for example, you have 50 patients and just 10 dialysis machines. What should you do? So it is very important to find them in the community. Don't forget case finding. Thank you very much.
Thank you so much for that last words, Dr. Hussain. So once again, thank you both, Dr. Hussain and Dr. Lim, for joining us and sharing your thoughts. So just to remind the audience that this is also the last session in our webinar series, Overshadowed by COVID-19, Neglected Diseases in the Spotlight. So thank you all very much for spending the last 4 weeks with us. In this series, we actually focused on 4 diseases: hepatitis C, measles, TB, and methanol poisoning. But of course, there are many other neglected diseases that require your care and attention. Do share what you have learned in our webinar series to your friends and your colleagues. So the more awareness and attention that we bring of these diseases, the more we can contribute really to saving the lives of those affected. So once again, thank you everyone, and I hope to see you again next time. Bye-bye.